Today, I'm taking you behind the scenes in an IVF center. When patients visit the IVF center, they think that we as doctors are doing everything. But the main work of IVF is done in the lab. That is where your first babysitter, the embryologist, is taking care of your little babies, your embryos, even before they meet you. Today, I'll introduce you to my lab in charge and chief embryologist, Angelica. Angelica has done her MSc in embryology from MGM Hospital and is a gold medalist. She has done her BSc Life Sciences from St. Xavier's College, Mumbai. She's passionate about her work, dedicated, and loves the embryology that she does. I'll now take you into the lab to meet Angelica, and then we'll have a little discussion with her.
Thank you so much, ma'am. That was a very lovely introduction, and I'm really happy to be here and to help patients understand what goes behind the scenes in an IVF lab.
So, not everybody sees the lab, not everybody understands the role that the IVF lab plays in the entire process. So, let's start at the beginning. Yeah, what is an IVF lab, and what are the things that you do to make sure that on a day-to-day basis it is running well?
So an IVF lab is the place where the oocytes, the embryos are cultured, and that's where the embryos spend most of their time before the embryo transfer or before they are frozen.
So embryology, Angelica, is a very unique and a niche segment, and not everybody still knows that something like this exists, right? So what was it that drew you to embryology? Why embryology?
So fertility is something that is very close to my heart, right, since childhood. I've seen it in my own family. My mother had trouble conceiving, and I was the fourth child after 3 losses. And when I was exploring careers, I always knew that I wanted to be in healthcare. But like every other student out there, I was really confused whether what will I be doing in my future. But that was sure that I wanted to do something which will give me a purpose and not just a conventional job like every other Gen Z out there. So when I was in my BSc, I was studying developmental biology, and that's when I was introduced to embryology as a course. And the most happening moment over there was when I had met an alumnus who was a clinical embryologist, and she came and she said that we help make babies, we help create families, we help make families complete. And that was the click. That's when it clicked that okay, I want to do this. This sounds exciting, and I'm gonna be an embryologist.
Totally. IVF itself is a field that is so satisfying that you're giving kids, like, to patients who have been waiting for years to conceive, have had a lot of difficulty, and in that you as an embryologist play a really major role, because the embryology is what determines almost 50% of the outcome of what's going to happen and whether they're going to get pregnant or not. So when we are looking at them getting pregnant, we obviously have to maintain the lab at particular standards and the sterility of the lab. So what is it that happens inside the lab to be able to maintain the standards?
Maintaining sterility in an IVF lab is extremely crucial because an embryo's development is totally dependent on that. So as embryologists, we make sure that we wear our complete protective gear, right from our scrubs, our mask, our hair cap, gloves. Everything is really up to date, really we have to be really particular in that. Even right from the moment I enter the lab, firstly, I make sure I clean everything. All my surfaces, then I check my incubators. I check the temperature, the gas levels, whether the flow pressure is maintained or not. All of that is really important, especially when your embryos are growing in these incubators. Now also these incubators have to be continuously functioning. because when these embryos are inside, any power fluctuation should not impact their growth.
Right.
So we have UPS and power backups at our clinic that make sure that our embryos grow without any interruption.
Yeah, that's so true. So the first thing that the patients hear from us when they're coming in for an embryo transfer is no perfume, no powder. So these are the things you take care of too, right? Because that's what would affect your air quality system. And the incubators need to be maintained because that's the first uterus for the baby that's being cultured in the lab. So the incubators being the first uterus, they have to maintain that temperature and the gas flow and everything. So that's how we can maintain the standards and make sure that you have a good outcome.
Yes.
Right? Perfect. That was great. So in India, Bollywood plays a really big role, right? And almost everybody has seen the movie Good News. And everybody knows that things can go wrong in the lab or thinks that that's the norm. That there are mix-ups that's going to happen. And today in the news, there's a lot about this too. So what are the precautions you take to make sure that you prevent these kind of mix-ups?
So in embryology, there is one rule that can never be compromised, and that is the right embryo must always reach the right patient.
True.
And to make sure that we follow all this, we have certain steps. Firstly comes traceability. Now traceability is the ability to track the location of every gamete, may it be the sperm, the egg or the embryo once they are produced outside the body. Then comes witnessing. Witnessing happens when, if the senior embryologist is doing the procedure, there will be another embryologist by her side who makes sure that everything, like she cross-checks everything,
Right.
that everything is being done
So
properly.
at all times there are two people
Yes.
checking everything.
Right.
Lovely.
That's called manual witnessing. And some clinics also have automated witnessing, but witnessing is truly important. And labeling is something which is very crucial. We make sure we as embryologists label everything, even if it's the consumable that we are using, may it be the dropper or the pipette.
Right.
Then our tubes, they have the names of the patient. So I'll go step by step with how do we do it.
Okay.
So it all begins with when we send the male partner for the semen sample collection. The container is labeled with the patient's details, the name of the partner, both the partners, the date of the procedure, what kind of procedure it is, whether it is semen analysis, freezing, IUI or ICSI.
Right.
All of those details are written. So it's also on the patient to make sure that they verify it before submission.
Okay.
Then once the container is handed over to the male partner, then we go to the egg pickup.
Okay.
Where
Can I
he-
ask you a question here? So this is when the sample is collected in the lab.
Right.
You're making sure that accountability is
Yes.
there. Often samples are not collected in the lab in certain severe conditions where they're not able to give a sample in the lab and we do it at home. The legal safeguards are done. At that point, how do you keep accountability of the sample?
So firstly, if a patient is unable to produce a sample in the clinic and they opt for home collection, at that times we have a particular affidavit which is made by us where it is clearly mentioned that the patient is aware that it, and the patient confirms that the sample that they are producing is of their own. So we have a legal affidavit which confirms this.
Okay, great. So then once now you have the sample in the lab, and so the next steps would be?
So once the eggs are retrieved in the OT, then once the eggs are collected in the dish, we collect the COCs and we keep them in the dish. That dish is also labeled with the patient's details. Right from the dish, each and every consumable is labeled. Then when ICSI is performed, that is when a sperm is injected into the egg, we label that dish as well with the patient's details. Then when the embryos are cultured, we label those dishes as well, along with when the dish is placed in the incubator, the uppermost surface, the lid of the incubator, that also bears the patient's details.
Right.
Yeah. Then when embryos are frozen, many patients have this doubt that are all my embryos, just kept all together? How do you all know whether it is my embryo or not? So embryos are frozen on a device which is known as a straw. They have multiple names. Now these straws have a certain color and they bear the details of the patient, including the name of the patient, then how many embryos are there, the grade of the patient, the grade of the embryos, and all of those details are written on the device, on the straw, as well as we also keep the details in our physical records as well as in a digital software.
Right.
So just in case, God forbid, but if anything happens to the physical records, we have a digital software where we know exactly where the patient's embryos are frozen or stored in the liquid nitrogen cryocan.
Right. So every article that is used for the patient in the lab is tagged to the patient,
Right.
so that it doesn't get mixed up, right? And that's how you make sure that everything is accounted for.
The most important point also comes during the embryo transfer, where the embryo is finally being placed in the woman's
Right.
uterus. So when we thaw the embryos, again their witnessing is done, the dishes are labeled, and the final step comes when the embryo is loaded in the catheter, where inside the embryologist, both the embryologists, they check whether the right embryo is loaded for the right patient. And then once the embryos are loaded, here many people play the role, where once the embryologist loads the embryos and takes it in the OT,
Right.
there not only the embryologist but also the nurse, the doctor, as well as the patient herself hears the name. We call out the name loudly so that everyone hears that the right embryo is being placed in the patient's uterus.
Right. So the patient here also
Yes.
confirms that I am the patient that you are talking about, and
Yes.
the transfer is done to
Yes.
the same patient.
Even in IUI, we do the same.
Right.
Our tube is labeled with the patient's details. So when we perform the IUI, we first show the tube to the patient that kindly confirm your details. So she knows that the right sample is being inseminated into her.
Perfect. Yeah. So mix up of samples, that is a nightmare for any IVF center. And that is the major thing that we really need to take care of, and I think every step that you have explained really takes care of reducing the risk to almost zero.
Yes.
Yeah, human errors can still happen, would they? No.
No, but we don't allow
No,
it.
I don't think so.
Yeah.
It's really very, very rare. The other thing that we do at our center is more like a boutique center where we do fewer cases. We don't do too many in a batch, too many patients on the same day. So the lab is not overloaded, incubator is not overloaded. So the chances of having a mix-up are almost next to nil.
Yes.
Right? So now we have the embryos in the lab. What happens then? How do you know whether they're growing, they're dividing? Do you check them all the time? How does this process go?
So firstly, we make sure that our embryos are growing undisturbed. There are certain checkpoints where we check for their growth, whether they are developing as per their potential, as per their timeline. So firstly, we do a fertilization check on day 2. That is when we check whether the 2PN is formed. That means the embryos have fertilized or not, the eggs are fertilized or not.
That means the egg and the sperm have met.
Yeah.
Okay.
Yeah. Then on day 3, so I'll just explain in short about how these embryos
Right.
grow. Once the 2PN is formed, 2PN indicates that the male and female the fertilization has taken place. Then on day 1, around 2 cells are formed. That is basically the cleavage happening. That is the cells are dividing.
Right.
So on day 1 we have the 2 cells. Then slowly on day 2 we have 4 cells. Then on day 3 we have around 6 to 8 cells. And all these cells, we are able to monitor them under a microscope. And we don't remove the embryos every time outside. There are certain checkpoints on where we check them. So on day 3 we should see the embryos having around 6 to 8 cells. And they should have minimal fragmentation. Then when we go to day 4, the cells then start to compact. And finally on day 5, they should be forming a blastocyst.
Right. So what we are saying is that outside in the laboratory, we can culture the embryos of the egg, fertilize it, and then culture it up to day 5.
Yes.
That's the maximum that
Right.
they can culture.
Yes.
And then at that stage, it can be put back into the uterus, and you're monitoring it as and when required at very crucial points, so that you know that the embryo is growing.
Yes.
Would this growth of the embryo also indicate whether your lab standards are met or not? How does that correlate?
Yes. So when we speak about lab standards, it goes beyond sterility alone. We make sure that our equipments are regularly calibrated and serviced. We perform routine swab testing to make sure that there is no contamination anywhere in the lab, which can hamper our embryo's growth. So all these lab standards finally are reflected in the outcomes, which is our fertilization rate, then the blastocyst formation rate, which means that the embryos that are cultured are forming blastocyst or not. So all of these factors, and finally the most important is a pregnancy rate and a healthy take-home baby rate. All these key performance indicators, as we call them, show us that our lab standards are of good quality.
Yeah, that's so true again, because every time a patient asks me what went wrong, before I jump on to saying that there was something wrong in the patient or the patient didn't do something correctly, we have to first evaluate inside. So evaluating the lab and seeing the lab standards gives us satisfaction that okay, clinically you've been fine, and then you can go ahead. So all these parameters help us to put that in place. Perfect. So in today's age and time, a lot of girls are coming in for egg freezing. A lot of couples are voluntarily doing embryo freezing, or after IVF cycles we are freezing embryos. So these embryos that are frozen, eggs that are frozen, are there in the lab with you, right? How do you take care of them?
So once your embryos are cryopreserved, we need to make sure that every day we replenish the cryotanks with liquid nitrogen. So the embryos are frozen in liquid nitrogen, which is at minus 196. Now for these embryos to remain in that state before they are again ready when the transfer is scheduled, it's very important that the temperature is maintained as well as the liquid nitrogen levels. So I make sure that I refill the cryocans daily. So I often joke that I'm an embryo babysitter, except that my babies live inside incubators and liquid nitrogen cryocans, and they need very specialized care.
They're not running around everywhere. That's an easy job then.
Yes.
Perfect, great. So I think we've covered a lot of IVF and embryo freezing and everything, but that's not always the first treatment of choice for patients, right? We are going to start with a process known as IUI, that is intrauterine insemination. So in this, the main role is played in the laboratory for the sperms, where you have the semen analysis, where you evaluate the sperms, and the preparation of the IVF sample. So we'll start with semen analysis. Could you explain to us what actually happens in a semen analysis, and what are the precautions that the patient should take before a semen analysis?
So semen analysis is one of the most basic types of tests to understand male fertility. Here we check two important parameters. Firstly comes the macroscopic parameter, which is something we can see with our own eye. Here we can check the volume of the semen sample, then the color of the semen sample, the odor, the viscosity, the pH, etc. The second part comes as the microscopic part, where we need the microscope to understand the sample. Here we check for the sperm concentration, that is the count of the sperms. Then we check for the motility, that is the speed of the sperm, and the morphology, that is the shape and structure of the sperm.
Talking about semen analysis and how we need to have a gap in the semen analysis, and we said that the ideal gap is about 2 to 3 days, right? So why do you think that would be the best number of days that we're looking at?
So before they have a semen analysis, we recommend patients that they have a 2 to 3 day abstinence gap. Now what happens is, if the gap is too old,
what you're saying is that they need to have a 2 to 3 day gap, which is very important, because what we have seen, and as biology has shown, that if the gap is less than 2 to 3 days, we get a lot of immature sperms. They haven't yet attained their full adulthood, as you call it. And if the gap is longer, more than 5-6 days, then you get a lot of dead sperms and old sperms, and you would give a report that would not be an accurate report, and that could confuse the patient. So it's important that these prerequisites are met, right? So now you have finished the analysis of the semen sample, and we are now preparing the sample for IUI. So what would be the steps in the preparation now?
So firstly, I check the identity of the patient. I make sure that the sample is liquefied for some time in the incubator. That is, it gets a watery consistency. Then I perform an analysis where I just check its pre-wash parameters. I mix it with some nourishing media and I give it a spin where we just pick the sperms that are of good quality. The centrifugation does that.
Right.
It separates the sperms into good quality sperms and bad quality sperms. Bad quality sperms and everything we get rid of, and only the good quality sperms are then collected in a labeled tube and they are then sent for the IUI.
IUI process. Perfect. So this would be something that you do absolutely on a regular basis, and this is a very similar process of sperm preparation that you'd use in an IVF also. Right? Great. So often you see semen samples that may not be normal. What are the commonest things that you see in such a sample?
So in a particular semen sample, either the count may be low, which we call it as oligospermia, or maybe the motility is poor, or the morphology is really abnormal. So most patients, when they get their semen analysis report, they are really worried just by looking at the numbers. So in a standard analysis report, I've seen that on the right, they get their reference ranges.
Right.
So if I take sperm concentration, for example, in the range it will be given as per the WHO range, it will be given as the sperm should be more than 16 million per ml. And when the patient sees his own value, it will be around 5 to 6 million per ml.
Right.
And that's when the patient starts getting worried. But I would like to tell such patients that it's okay if you have a low count or poor motility. You do not need to freak out at those values, because even if we get one good sperm for one egg, that is sufficient. But it all depends on your lifestyle and diet. All of that is important because the choice you make today will decide the quality of your sperm sample after 3 months.
Right.
Because sperms are continuously produced and renewed over 3 months. So it is important what choice you make in terms of your nutrition, your diet, exercise, sleep, avoiding smoking and excessive alcohol, etc.
Okay, that's great. So yeah, it's like a report card. Right? All patients are waiting what percentage they got.
Right.
And obviously in any exam, if you get a low percent, you're scared. But in IVF, science has helped.
Yes.
And even the ones with low percentages now can have a pregnancy and really do well with that. That's perfect. In the middle somewhere, you talked about media and something that nourishes the sperms and embryos. Could you elaborate a little bit on what you mean by media?
So media is the environment where the egg, embryos or the sperms spend their time inside the culture dish. It's a liquid environment which mimics the fluid which is actually present in the fallopian tube and uterus. So if the embryo is in the media, it doesn't feel like it's outside the body.
Right.
It feels as if it's inside the body.
Okay.
So the media contains many nutrients, growth factors, amino acids, etc., which nourishes these embryos. So what we do is usually we keep the media in a refrigerator, but when there is a procedure, when we know that embryos are going to be cultured in the media, we equilibrate it.
Okay.
Now equilibration is nothing but we set the media at the right temperature, at the right gas levels. It mimics the constituents which are present in the woman's body.
Okay. So basically you're saying that the lab may not be the heart of the IVF center, but more like the uterus of the IVF center.
Yes, you can see
Where
that.
you're maintaining the environment and the temperatures exactly as the baby would want when it is in the womb. So it's more the womb.
Yes.
Great. And you are the caretaker.
Yeah, babysitter.
The babysitter. Lovely. We had a nice talk. Is there anything I've forgotten to ask you, or anything that you want to tell us that you think is really important for all of us to know?
I would like to say that I may not know the fate of the embryos which are under our care, but while they are with us, we make sure that we keep them safe, we monitor their growth.
And the patient should feel absolutely safe in your hands.
Yes.
Thank you. Thank you for being with us. and thank you for giving us answers in a manner where I think most of the patients watching you would be very happy to be able to understand in the simple language and be able to look at their IVF process more differently now.